Good morning to everyone. My name is Mrs.Mithra Devi. I am nursing tutor and working in E.S College of Nursing, Villupuram. Today we are going to see about anesthetics drugs. Okay. First, probably we can see first what are the slightly improvement about anesthetics introduction. Okay, father of anesthesia John Snow and founder, and father of modern anesthesia is W.T.G. Morton. The term anesthesia was coined by Oliver Wendell Holmes. Okay, the word anesthesia day is 16th October, and anesthesia means mainly there is a no sensation we call. Okay, first what it means anesthetics. Okay, anesthetics are the agent that bring about reversible loss of sensation. They may be a general or local anesthetics. Okay, so anesthetics we are giving to the patients during an OT, operation theatres only probably, and mostly it's reversible loss of sensation. First the sensation will be lost and again it will be a reversible and come to a conscious. This is the meaning of the anesthetics. Okay, they may be a general or local anesthetics. There are two ways they are introducing anesthetics into our body, and there are 4 types of anesthesias are available. Okay, first one is spinal anesthesia, epidural anesthesia, local anesthesia and general anesthesia. First we see general anesthetic. Okay, general anesthesia are the drugs that bring about the reversible loss of sensation and consciousness. A nurse should have a sound of knowledge about anesthetic and stages of the anesthesia to assist in anesthetics procedure and manage the anesthetics accidents. Mostly the anesthetic sound of knowledge we have to know about in postoperative ward. Okay, after the surgery is finished, the patient is shifted to the postoperative ward. As a nurse, we have to know about what are the sound of knowledge related to anesthetics. Mostly we have to hear how the reversible loss of sensation is reversible to the patients. Okay, it is a combination of medication that put in sleep wake stage and before surgery and other medical procedure. You don't feel pain because or completely unconscious when you give anesthetics to the patient. General anesthesia usually a combination of IV drugs and inhaled agents. Okay, general anesthesia means probably we can give to the patient through the intravenous drugs and inhalation forms also. Okay, and now we see essential components of anesthesia. There is a 4 main cardinal features of anesthesia we can call after the anesthesia is introduced to the patients. Okay, first one is loss of sensation or pain. Okay, next stage sleep and amnesia, and the patient have to the third stage is immobility and muscle relaxation, and fourth is abolition of somatic and autonomic reflexes in our brain and spinal cord. Okay, next we see stages of general anesthesia. What are the stages? Mainly 4 stages we can call. Okay, first stage is stage of analgesia. It is from the beginning of the inhalation of anesthetics to the loss of consciousness. First we introduce the anesthesia to the patient. The stage 1, the patient goes to the inhalation of anesthesia. First thing is loss of consciousness. Second stage is delirium. Stage of delirium. This stage is from loss of consciousness to beginning of the surgical anesthesia. It may be associated with excitement, shouting, crying and violent behavior. Sometimes the patient is given to anesthetics to the patient. The patient is shifted to the operation theatres. Some patients will laugh, shouting, crying, violent. These are the stages. It is called a stage 2. Okay, in the OT itself, stage 3 and stage of surgical anesthesias, it has 4 planes are available. Okay, as anesthesia passes deeper planes, next respiratory depression is seen in our brain. Okay, there is a gradual loss of reflexes and relaxation of the skeleton muscles. Okay, next 4th stage of the medullary paralysis. This is a last stage and complication of the patient if the patient is goes to the overdose. Okay, it is seen only the overdose. It is the stage of odd medullary depression, cessation of the breathing. Some patient the overdosage to the patient of anesthesia, the patient goes to the respiratory depression also and the breathing difficulty also. Sometimes the circulatory failure also will come, and finally the patient goes to the there is a chances of the death. Okay, Next stage, next classification we see through the what are the routes we are giving anesthesia to the patients. Mainly we can see a inhalational form and intravenous forms. Okay, first inhalational forms. Inhalational forms we are given through the oropharyngeal mask only, we can see in an OT. Okay, and inhalation anesthetic is a chemical component possessing general anesthesia property that can be delivered via inhalation. The inhalation bombs through administered through mainly face mask, laryngeal mask, airway or tracheal tube. Anesthetics vaporizer, it is one of the anesthetics vaporizer machines which has be a OT table nearby the head of the backsides, patient's backside. Okay, anesthetics delivery system. Mostly probably they are giving laryngeal mask airway through the anesthesia airway to the patients. More rarely we can give a tracheal tube only. Okay, face mask, laryngeal mask airway is a LMA only, most probably we are giving to the patients in the OT. Next, classification of inhalational anesthetics. Okay, there are two classifications forms are available inhalational anesthetics, that is gaseous form and liquids. Okay, gaseous forms we are called as nitrous oxide, cyclopropane, xenon. Okay, liquids forms we are available in ether, halothane, efflurane, isoflurane, dissoflurane, sevoflurane. Okay, so gaseous form and liquids forms are available in inhalational anesthetics. First we can see a nitrous oxide. You already know what is mean a nitrous oxide. It is a laughing gas, we are know. Okay, nitrous oxide was first named by Humphrey Davy. Okay, it is synthesized by Joseph Priestley in the 1772 and it is also called as a laughing gas. Okay, and it is a poor anesthetics and good analgesics. That means the nitrous oxide introduced to the patient giving inhalation forms, so only the patient will rehearsable and came to the consciousness. So it is called as poor anesthetics and there is a no disadvantages of nitrous oxide, that is a good analgesics we can call. Okay, and so that only they are telling fast offset and easy recovery easily. Okay, most safest drug non-inflammable and not inflammable. Okay, and it is disadvantage, that is produce a light anesthesia, therefore can only be used as along with other anesthesia. Not only give nitrous oxide separately to the patients. Okay, along with some anesthetic drugs combination only they can give, because it is the fastest offset of the recovery and it is off life is very short period. Okay, next ether. Okay, it is a colorless volatile liquid we can call and it is a emetic and explosion. Ether is normally it's a bad smell, something is and it is called as a pungent smell also we can. The first demonstrated by ether is W.P.T. Morton on 16th October 1846 and agent with the maximum of skeletal muscle relaxer and good analgesics, and so it is a complete anesthetics agents only. Only inhalational agent that stimulate the respiration. It has no side effects for on heart. It is one of the advantage of the ether and is the safest anesthetics in untrained person. Untrained person sometimes we can use ether as analgesics to the inhalation form and highest in nausea vomiting. That is one of the disadvantages patient is having adverse effects of the nausea and vomiting for ether. Halothane. Okay, it is a potent volatile anesthetics and non-inflammable, non-toxics it is called. Okay, and sweet smelling agents, it is also called as sweet smelling agents and causes smooth inhalation and induction in children. Most probably halothane is used for children only, and vaporizer colors of anesthesia machine is red color. In that vaporizer halothane will be there. Okay, it has one of the side effects. Two of the side effects is bradycardia and hypotension. Sometimes the patient goes to, and sensitive to the myocardium. Sometimes arrhythmias as comes to the side effects of halothane will use. Next, halothane is advantage and disadvantage. Okay, first advantage is powerful bronchodilators mostly used in asthma patients. Okay, so the patient is having asthma complaints, have go to the OT. Mostly halothane not mostly compulsory, the halothane only given to the asthma patients for inhalation anesthetics, and it is a good uterine relaxant for manual removal of the placenta. Sometimes rarely it will use. Okay, disadvantages postpartum trauma due to uterine relaxation mainly, and it will be causes of the 5 H's of disadvantages: hypothermia, hepatitis, hypotension, hypercapnia, and heart rate sometimes also decrease. Okay, it is a disadvantages of the halothane. Next, chloroform. You already know chloroform is a sometimes you can use in some area. Okay, first agent is used for labor anesthesia is chloroform, and it's a cardiac toxic agents, highly emetic agents, hepatotoxic. It is a disadvantage is hepatotoxics. Okay, liver metabolization only mainly will form in the chloroform, and it is causes is hyperglycemia. One of the disadvantages also called as chloroform is hyperglycemia. So blood sugar will be increased sometimes. Next is sevoflurane. Sevofluranes you can use here in a vaporizer, anesthetics vaporizer, and it is a color is yellow color vaporizer. Okay, it is a pleasant smell, non-irritant and bronchodilators, and makes a anesthetics of choice for pediatrics patients. Most probably sevoflurane is used as a pediatrics patients, and vaporizer color is yellow and most appropriate agents. Okay, if a patient, pediatric patient go to the OT, they will give a sevoflurane, will advise to the patients. Next, desflurane. Okay, it is a fast inducing agent, so the agent of the choice for the day carbon. Pungent smell. Okay, desflurane is a pungent smell and boiled and melt at room temperature of 22.2 degrees Celsius. So special vaporizer is needed, and it is a vaporizer color is blue. Okay, hepatic and renal blood flow are maintained depressed, so the agent choice is renal failure. Next, isoflurane. Okay, most common anesthetics agent is isoflurane, and it is a renal hepatic function minimal affected inhalational agent, and cardiac anesthesia, neuro anesthesia, rival transplantation, they isoflurane only they will use, and it is a vaporizer color is purple. Inhalation agent of the choice. Okay, so shortly we can know what are the anesthesias and agents are used. Neuro anesthesia, isoflurane; cardiac anesthesia, isoflurane; hepatic surgeries related to isoflurane, or sometimes the dissoflurane also used. For pediatric anesthesia mainly use sevoflurane; daycare anesthesia, desflurane; anesthesia for asthma patients. Okay, halothane. So shortly we can point out the inhalation of the choices. Okay. Next, intravenous anesthesia. Now we can see a intravenous, through the intravenous routes what are the anesthesia are given to the patients. Okay, it is used to induce the state of impaired awareness of the complete sedation. Okay, so completely patient have to sedate the loss of consciousness. So mostly intravenous routes only available. They will use. Okay, intravenous anesthesia allow extremely rapid induction because of blood concentration can be raised rapidly in few seconds, and there is a loss of consciousness. Okay, but when we administer anesthetics intravenously, there is no channel quick elimination like the lungs. Moreover, the elimination of the inhaled anesthetics can be made faster by induced hyperventilation, while this is not possible with intravenous anesthetics. Okay. Next, first we see intravenous anesthetics agent thiopentane. Okay, it is ultra short acting barbiturate. It comes under barbiturate classification and is a pale yellow color powder form only available in amber, and very high pH is 10.5 to 11, and dosage is 3 to 5 mg per kg for the adult. Okay, drug of choice thiopental mostly they will use in head injury, decreased intracranial pressure, decreased cerebral and oxygen demand patients. Okay, next ketamine. Okay, ketamine, it produces a dissociative anesthesia and patient consciousness but unresponsive. Sleep occur 5 to 10 minutes of IM injection and 10 to 10 seconds for IV injection. Ketamine sometimes been used in endotracheal intubations also. And advantages and disadvantages of ketamine. Advantages: decrease the airway upper reflexes, sympathetic stimulant, drug of choice for hypovolemic shock and asthma. Dosage is IV 1 to 2 mg per kg, and IM means 5 to 10 mg per kg. Mostly IV only they will use a ketamine. Ketamine may be anesthetics of choice when supply of the oxygen equipment and monitoring the patient. Ketamine mostly we ET intubation time. Okay. Disadvantages: ketamine increase the ICP, IOP, BP, that is intracranial pressure, intraocular pressure and blood pressure also. And hallucination may occur due to increase of IVCP. Okay. Next, Propofol. Propofol we can probably be seen in a intensive care unit. It is a milky form only its looks, okay. It is rapid onset of 40 seconds and IV anesthetics of choice for short or day care procedures. Maximum supplement of the upper airway reflexes and drug of choice is for LMA insertion, that is laryngeal mask airway insertions, and it produces a strong antipruritic antiemetic effect. Mostly Propofol is we can use it in intensive care units only. Next, contraindication for Propofol is egg allergy. Open vial should be used within 6 hours. It is a main contraindications, okay. When the Propofol is opened, we can use it within 6 hours we can use. Otherwise, after the 6 hours, we have to discard to the waste, okay. It is a milky white color and IV injection is very painful, and dosage is 1 to 2 mg per kg for adult according to the weight. Next, ethiomeride. It is used as a hypnotics but not an analgesics. Most cardiac stable agents do not increase or decrease the heart rate. Maximum nausea, vomiting in post-op times only. Okay, dosage of the induction is 0.2 to 0.3 mg per kg. Next, fentanyl. Fentanyl we can use it as a opioid analgesics. Okay, it is a more potent an analgesics than a morphine. Rapid onset and rapid recovery can be given in daycare surgery in ICU patients. Okay, so ketamine, fentanyl and propofol, these are the drugs most probably we can use in intensive care units only. And finally we can see generally complication of general anesthesia. During the anesthesia, what are the complications will occurs means respiratory depression, hypercapnia, salivation, respiratory secretions, cardiac arrhythmias, asystole, that is patient goes to fall in BP, hypotension, aspiration of the gastric content and laryngospasm. After the anesthesia of the complication of general anesthesia is nausea, vomiting, persisting sedation, pneumonia, atelectasis, organic toxicity, that is liver toxicity, kidney can damage. Okay, nerve palsy due to faulty positions we can administer the general anesthesia also. Next, delirium in emergency situations. Okay. Next, what are the pre-anesthetics medications are given when the patient is go to the before OT? Before administration of anesthesia, certain drugs are administered in order to make anesthesia safer and more pleasant, not as pre-anesthetics medication. It is given in orders. Why the pre-anesthetics medications are given to the patient before go to the OT means decrease the anxiety level mainly. Okay, provide amnesia for pre-op period, deliver of the pre-op pain if present, make up anesthesia safer, reduce the side effects of anesthesia and reduce the gastric acidity. Next, pre-anesthetics medication, what are the medications are there? For sedative, the sedative drugs given for anti-anxiety drugs, diazepam 15 to 10 mg oral, lorazepam means 12 mg to 0.05 mg per kg, pethidine and fentanyl is counteract to CNS toxicity of local anesthetics, and midazolam is good amnesia with the potent and shorter lasting actions. Local anesthesia. Okay, general anesthesia completely over. Now we see local anesthesia. The local anesthesia, they prevent a transmission of nerve impulse without causing unconsciousness. They act by binding to fast sodium channel from within. Next, classification of local anesthesia we can use based on the route of administration and duration of the action as we follows. Okay, first classification of the injectable form. Injectable form, short acting, intermittent acting, long acting. Short acting is procaine, chloropropine. Intermittent acting is lignocaine, prerilocaine. Long acting is tetracaine, bupivacaine, dipivacaine, ropivacaine, eticaine. Next, surface anesthetics we can use lignocaine, cocaine, tetracaine, benzocaine, oxytocin. Okay. So, mechanism of action for generally local anesthesia is to prevent the generation of the conduction of the nerve impulses. The primary mechanism is blockage of the voltage gated sodium channels in our body. Okay. Small nerve fibers are more susceptible as they present greater in surface area per unit volume. The smaller fibers are blocked first. Local anesthesia is absence of sensation in specific part of the body. What does mean local anesthesia means? Specific part of the body only we can lose the sensation, but general anesthesia all over the body, but local is specific part only we can lose the sensation. Cocaine is first used local anesthetics. Drug used now lidocaine or xylocaine 2% is most common in hospital setups. Okay, and dose is 4.4 mg per kg and 6.6 mg per kg with adverse effects. Okay, addition vasoconstrictor decrease the systemic absorption and increase the duration of action of the local anesthesia. Example, adrenaline and noradrenaline. Sometimes the local anesthesia along with the adrenaline also will use to increase the effect of the anesthesias. Local sodium bicarbonate with the local anesthesia is increase the onset of the action and duration. Sodium bicarbonate with the lidocaine are more rapid. Benefits of the adrenaline added to lidocaine is epidural projection include prolongation of duration of action of the lidocaine, better quality of the block, delayed absorption in systemic circulation, therefore by increasing probability of local anesthetics toxicity. And what are the local anesthesia are tetrazine, lidocaine, benzocaine, pilocaine, mepivacaine, bupivacaine. Tetracaine is 1 to 2% of ointment eye drops and uses as topical spinal anesthesia. Lidocaine used as a spray form, jelly, ointment or cream 1 to 10% for injection, that is topical infiltration, nerve block, spinal epidural, IV regional anesthesia. Benzocaine is 1 to 2% a dusting powder, sometimes suppository, cream gels, ointments, sprays also available, uses for topical anesthesia. Prililocaine 5% cream, 4% injection, topical nerve block anesthesia. Mepivacaine is 1 to 3% of injection, nerve block or epidural. Bupivacaine 0.25 to 0.75 injection, infiltration, nerve block, spinal epidural. And the nerve block injections anesthesia mostly we conceive for oncology patient continuously have to give the infusion for anesthetic infusion in the spinal block. Okay, mostly bupivacaine, ropivacaine only they can use it. Okay, next bupivacaine 0.25 to 0.75 injection, infiltration, nerve block, spinal epidural anesthesia. Ropivacaine 2 to 10% of injection, epidural anesthesia. Next, final anesthesia. General we seen, local we seen, next spinal. Spine we can use as a C-shaped sitting position and also known as subarachnoid block or spinal block, and give at the space of L3, L4 for adult, L4 and L5 for children, and needle size is 27 gauge. Drug use. What are the drugs we can use? Ropivacaine and bupivacaine, most common used dosage of 10 to 15%, and effects of the spinal anesthesia is tidal volume and arterial blood gas remain unchanged. Okay, it decrease the maximum breathing capacity, active the exhalation due to paralysis of intercostal muscle. Cardiovascular system, vasodilate lower limb and venous pooling in legs and hypotension. Next, spinal anesthesia factor affecting level are more volume, more highest of the block. Tall patient require more drug. Obesity, ascites, pregnancy require less amount of spinal drug only. Complication of the spinal, most common spinal anesthesia complication is hypotension only, and nausea, vomiting, apnea, urinary retention, post-punctural intake also will come. Spine needle type, mostly spinal quinine or Pitcairn green needle. Okay, so it is a quinine, it is a dura cutting spine needle, so more chance for PDPH. And Pitcairn green needle is a spinal pencil tip needle which split the dura, so less chance of PDPH. And indication for spinal is lower abdominal surgery, LSCS, knee replacement surgery, lower limb surgery. Contraindication for patient refuser, raised ICP, infection at the root. Epidural anesthesia, most used for post-op analgesic, painless labor and surgeries, and it is given to between the dura and ligamentum flavium area. Okay, commonly used epidural anesthesia. And what are the drugs used is lidocaine, ropivacaine, opioids. Complication of and is apnea, hypotension, total spinal drugs reach to medulla and patient become unconscious. High spinal causes of hypotension, bradycardia, but the patient remain unconsciousness. Adverse effects, nausea and vomiting, pruritus, urinary retention, respiratory distress and sedations. Okay, what are the general nurses' responsibility of the anesthesias? Okay, role of nurse. Preparation for anesthesia in recognizing a general and specific anesthetic respect in order to improve the patient safety. Ensure the pre-operative investigation when the patient comes to the post-op ward is ECG, chest X-ray, blood group, HIV or hepatitis B, antigen, blood gas sensation. Before administering anesthesias, and ask a patient whether he or she is allergic and to any medicine, food, dyes or preservatives. Monitoring of the patient under anesthesia includes circulation, oxygen and ventilation. Okay, so role of nurse mainly role in post-operative ward only after the patient comes to the surgery. Management of the temperature during the anesthesia is very important. Sometimes the patient goes to shivering, so hydrocortisone steroids have start in the post-op hour, and observe the side effects of anesthesia for patient going home within 24 hours after receiving general anesthesia, because it may cause to drowsiness, tiredness and weakness for few days after have been given. Okay, they may think also some problems have come with coordination, thinking and ability to think also. Instruct the patient to drive, use machines and for at least 24 hours after receiving a general anesthetics. And records keeping is essential common for perioperative care, and record should be include all drug administered, dose, time, route of administration. Yes, thank you.